So I want to tell you a story. In fact, this is a true story and I'm not making it up. There's a 38-year-old policeman called me some time ago. In fact, he got my number from a friend and then he called me with complaints of recurrent abdominal pain. And in fact, he told me that he had a history of ulcer, and so he felt that the ulcer was the cause of his recurrent abdominal discomfort. So I prescribed some medications for him, and I think he was doing well for some time. He called me about a month later with the same complaint, and so I asked him to come to the hospital for a checkup. And when he came to the hospital, in fact, I noticed that his eyes were yellow. He looked like someone who had lost a lot of weight because his zygomatic bones were very prominent. He looked very weak, very lethargic, and his abdomen was a bit distended. He actually came with a lady he told me, he said they were about to get married, blah, blah, blah. So when I saw him, in fact, I was actually scared because I knew it was a liver problem. So we did an abdominal ultrasound scan, and it confirmed what I was thinking. He had developed a particular condition that was caused by a chronic infection that went unchecked. An infection that is deadlier than HIV/AIDS. My people, I'm sure you are all wondering what infection is giving this man all these problems. It's hepatitis B, a single disease that is deadlier than HIV/AIDS if it is unchecked. So that brings us to the first question. What is hepatitis B? Okay, so hepatitis B is actually a viral infection that majorly attacks your liver. Okay, so it can cause both acute, which means short-term, or chronic infection, which is long-term. And so you must understand that there are some people who would contact hepatitis B and may not necessarily develop an infection. Meanwhile, because the liver tends to clear it up some way, somehow. But there are other people who would develop or contact hepatitis B and may have either an acute infection, which usually takes about less than 3 months, or have a chronic infection, which probably has been going on for more than 6 months. This now leads us to our next question. How can someone contact hepatitis B? Okay, it's just almost the same way as HIV/AIDS. When someone comes into contact with infected bodily fluids, okay, so bodily fluids like saliva, blood, vaginal fluids, semen, okay, so you can contact hepatitis B through all these things that I've mentioned. Transmission of the virus may also occur through reuse of contaminated needles, syringes, sharp objects. So if, for instance, guys who go to the barbering shop, if someone has hepatitis B and the person came for a shave and got a cut, and that razor blade or whatever was used for another patient, okay, it's likely that the virus can be transmitted to that person. More prevalent is sexual transmission, which usually occurs in unvaccinated people with multiple sexual partners, okay, and also pregnant women can transmit hepatitis B infection to their babies during childbirth. Please and please, you cannot get hepatitis B from sneezing. So you are sitting in a trotro, or sitting in a private car, someone sitting close to you sneezes. No, you cannot get hepatitis B through that. Coughing, no. Handshake, no. Exchange of maybe clothes or something, no, you cannot get hepatitis from that. By the way, if you've still not subscribed to this channel, please and please, I'm begging you, help this channel grow. We can reach out to a lot of people if you subscribe to this channel. Please hit the subscribe button. Please hit the subscribe button. It is there. Hit it. Are you done? Then hit the like button. Okay, then turn on your post notification bell so that we continue. So how do you know if you have hepatitis B, or what are the symptoms or signs of hepatitis B? But before that, my people, there's something I need you to understand. Please and please pay attention. About 70% of people with hepatitis B, when they are newly infected, will not show any symptoms. And that makes it very dangerous. However, those with symptoms, okay, in the initial stages, we'll have fever, lethargy, nausea, abdominal discomfort, sometimes vomiting, and they may have yellowing of the eyes and the skin, and that is a sign that your liver has been affected. Now, you must understand that if you have hepatitis B and it causes a chronic infection, okay, there's something that can happen to your liver. Okay, now once there's a chronic infection, it can cause what we call inflammation of your liver, and the liver tries to heal itself. Then it causes an inflammation. The liver will heal itself. Cause an inflammation. The liver heals itself. Now, once that happens, it leaves a scar on your liver. Too much scarring of your liver can cause what we call liver cirrhosis, which renders your liver practically useless. In most cases, once the patient develops a liver cirrhosis, it can progress into a liver cancer, or what we call hepatoma or hepatocellular carcinoma. So in summary, all I'm saying is that once you have a chronic infection from hepatitis B, okay, you can develop a liver cirrhosis and then subsequently develop hepatoma or liver cancer. Or in some cases, even with the chronic infection, it can move straight to a hepatoma even without developing a liver cirrhosis. My people, once you develop a liver cancer, you need to start singing the song "Nearer My God to Thee" or "I'm Coming Home, Lord," because more often than not, they usually die. In fact, the prognosis is very bad once you develop a liver cancer. The first liver transplant that was done in Ghana here was a disaster. So once you develop liver cancer, that is it. Now, how can we manage hepatitis B, or how do we manage hepatitis B? Now, before we talk about the management of hepatitis B, you need to understand that hepatitis B can be prevented. So my people, you see why you need to subscribe to this channel and share this video to your loved ones so that we can create health awareness, because this is a preventable condition. Nobody needs to die from hepatitis B because it can be prevented. How do we prevent hepatitis B? Through vaccines. That's the best way to protect yourself. Hepatitis B can be prevented through the hepatitis B vaccine. So the hepatitis B vaccine comes in 3 doses, okay, that adults and children can take. Okay, so the first 2 doses can protect you, up to some time, but the 3rd dose can protect you for at least 20 years or even for life. For some people, I know they've not taken the vaccine before, but there are other people too who have taken the vaccine, okay, and it's been very long and they cannot really recall if they've taken all 3 doses. If that is your case, okay, pause this video. In fact, before you pause, subscribe, pause this video, and then go to the hospital. Okay, when you go to the lab, tell them that you want to do hepatitis B titer test. Did you get that? Hepatitis B titer test. Now, what is this hepatitis B titer test? Now, this titer test simply measures the level of antibodies in your blood against the hepatitis B virus. It's very simple. It measures the level of antibodies in your blood against the hepatitis B virus. Okay, so this is how vaccines work. When you're taking a vaccine, okay, the vaccine stimulates or boosts your immune system to produce something we call antibodies, and these antibodies are what actually fight against these viruses. So let me explain further and make it a bit practical. Okay, so your antibodies are like soldiers, military men. Okay, please, I'm not talking about the policemen. Okay, no disrespect to police. Shout out to the police service. I'm talking about soldiers. Okay, because hepatitis B virus is actually a war. Okay, so you need soldiers to fight in this war. All right. So what the titer does is it measures the level of antibodies, or the level or the number of soldiers, okay, in your blood that can fight against this hepatitis virus. Okay, so once the level of your antibodies are high, then it means that you are immunized against this hepatitis. Once it's low, then what it means is that you need to go in for a booster. So in summary, what the hepatitis B titer test does is that it checks whether you are immune to the hepatitis B, either from a past infection or from being vaccinated. So like I said, if the level of your antibody is high, then it means you are protected from the virus. However, if it is low or is absent, then you need to go in for a booster. This is the case of people who have taken the vaccine before and cannot recall if they've taken all 3 doses. I'm sure someone is asking, so if I have a chronic infection from hepatitis B, Can I still take the vaccine? Please don't waste your time. Okay, what the vaccine does is it prevents you from getting the infection. Okay, so if you've not been exposed to hepatitis B, what the vaccine does is it prevents you from getting the infection. Not when you've been chronically infected. I mean, the vaccine will be of no use. So I've been mentioning acute infection, chronic infection from hepatitis B. Okay, so most of the time when they come to the hospital, this is how we determine that. We usually request for a lab, called hepatitis B profile, and through the IgG or IgM, we're able to determine whether the patient's hepatitis is an acute phase or in a chronic phase. Okay, there's no specific treatment for patients with acute hepatitis B. Okay, usually we advise them to eat a healthy diet, drink a lot of fluids, okay, to prevent dehydration from excessive vomiting, and then also diarrhea. So those with chronic infection from hepatitis B, we usually put them on antivirals, not antibiotics, antivirals, so tenofovir and entecavir. Okay, now the goal of treatment is actually to prevent the progression of the chronic infection to a liver cirrhosis, and also to reduce the cases of liver cancer, and also to improve the quality of life. Okay, now you must understand that if you are on the antivirals, you must be on it for life. My people, you can imagine taking medication for the rest of your life. Every day you are drinking medicine. Hey, it's not a joke. In fact, it's not easy. That's why I've said that if you don't know your status, in fact, if you don't know whether you've taken the vaccine from childhood or for the past 20 years you've not taken the vaccine, please go to the hospital immediately. When you get there, tell them that Dr. Yankee said they need to check their hepatitis B status. If it is negative, you know what to do. Take the vaccine immediately. So how do you reduce the risk of contacting or spreading hepatitis B infection apart from taking the hepatitis B vaccine? Okay, the first thing you need to do is practice safe sex. Please use a condom, and then also reduce sexual partners. The second thing is that please wash your hand with soap and running water. Okay, when you come into contact with body fluids like blood, urine and all that. And then also please avoid sharp objects or equipment for piercing, tattooing, needles and all that. Please avoid them. So in conclusion, if you are not very sure, okay, as you are watching me, if you're not very sure about this vaccination thing, of course I'm sure some people are, they are not sure, please, it only makes sense for you to check and get yourself vaccinated. Protect yourself for life. If you're a pregnant woman and you have the virus, okay, don't be worried. Your doctor during your antenatal will put you on a drug that can prevent you from transmitting it to your baby. Okay, and even in babies who are born to mothers with the virus, okay, they can be given an injection to prevent them from developing the infection. Unprotected sex is a no. And so if you believe, like I do, that no one should die from hepatitis B, which is a preventable condition, please get yourself checked, get yourself vaccinated, and kindly support this channel. Hit the like button, hit the subscribe button. Kindly share this video to your loved ones. Let's create this awareness. Okay, I'll see you in the next video.